Social anxiety, to an extent, is natural. In this video, I'm not referring to shyness. Shyness by itself is not pathological. Shyness is not the same thing as social anxiety disorder. Shy persons don't have significant impairments in their social or occupational functioning. Social anxiety disorder, on the other hand, is characterized by an intense fear of social situations. The person fears being judged by others as anxious, boring, unproductive, or unlikable. This intense fear of social situations causes psychosocial impairments. For example, it increases the risk of dropping out of school, it reduces workplace productivity, and it damages the quality of interpersonal relationships. Social anxiety disorder is one of the most prevalent mental disorders, with a lifetime prevalence of 13%. This mental disorder has an early onset, 13 years of age, and is often chronic. Social anxiety disorder is associated with an increased risk of depression and substance abuse disorders. In addition to this association with other mental disorders, social anxiety disorder increases the risk of cardiovascular diseases. And that is because social anxiety causes an autonomic hyperarousal. It leads to the release of stress hormones that cause the person to blush, to sweat, to tremble, and to have palpitations, sensations regarding irregular heartbeats, and a higher blood pressure. In children, to be defined as social anxiety disorder, the anxiety must occur in situations involving peers and not only during interactions with adults. Their fear or anxiety may be expressed by crying, tantrums, freezing in place, or failing to speak in social situations. If your children have social anxiety, note that playfully encouraging risky behavior helps decrease their risk of social anxiety disorder. Social anxiety disorder remains both underdiagnosed and poorly treated. Only about 35% of persons with social anxiety disorder receive adequate treatment. Persons with social anxiety disorder visit their primary care physician less frequently, and those who do seek care avoid talking about their social anxiety. Social anxiety disorder can be treated with drugs like SSRIs, selective serotonin reuptake inhibitors, with psychotherapy, or with both. As it is the case for OCD, obsessive-compulsive disorder, that I mentioned in an earlier video, drugs may be preferred initially for patients for whom the psychotherapy is too frightening. Several forms of psychotherapy are available for the treatment of social anxiety disorder. Cognitive behavioral therapy is currently regarded as the first-line treatment. In high-quality studies, cognitive behavioral therapy as the treatment for social anxiety disorder yielded response rates between 50 and 65% compared to 30% response rate for placebo. Other forms of psychotherapy are also used to treat social anxiety disorder. Mindfulness-based stress reduction resulted in lower response rates, 39% when compared to cognitive behavioral therapy at 67%. Cognitive behavioral therapy involves exposure to social situations and addresses negative beliefs the persons with social anxiety disorder may have about themselves. This therapy helps to expand the comfort zone for the person with social anxiety disorder. The mindfulness-based therapy doesn't seem to have significantly better responses than placebo, and to an extent it may be because it solely focuses on stress reduction. It doesn't focus on expanding the social situations where the person with social anxiety disorder will feel comfortable. If you happen to have anxiety in some social situations, aim at exposing yourself to those situations. Do it slowly but progressively.